Hello, everyone. Welcome to this audio podcast. In this audio podcast series, the Extracts Equilibrium. This is a sort of a research retrospective on works that had been developed and where there was wherein there was an industry, sort of industry and academic collaborative approach to this works, and the works surrounding using technology to improve health of community pharmacy. And once again, this is the Shientist, and I'm going to provide a sort of an extract around this works. So, and again, using technology to improve health of community pharmacy. So the aim of this investigation was to explore sort of current methods or methodologies of information technology or IT training and support available to community pharmacists and investigate how these sort of modalities can be refined in the future. Technology is changing or has been changing the role of community pharmacy by providing a great sort of arsenal of tools. And as such, robust training regimes should be sort of available to enable pharmacies to maximize the sort of advantages technology can provide. Um, and in instances of sort of inadequate training surrounding information technology and systems, it can result in sort of errors which pose a risk to patients. And the research sort of methodology that was implemented or conducted was mainly sort of qualitative based research, and seek to begin a sort of seek to or sought to begin a series of recorded semi-structured focus groups held with sort of numerous pharmacists excuse me numerous pharma numerous pharmacists sort of purposefully sort of selected due to sort of their sort of involvement in community pharmacy and community pharmacy varying as such sought to wherein the research sought to bring about various discussion points and views. And after completion, sort of audio recordings were transcribed and verbatim, and in addition was sort of thematically analyzed, thematically analyzed, um, um, using works and sort of literature from the works by Braun and Clark's six-step sort of methodology in and around analyses. And in total, 11 participants were interviewed over two particular two particular focus groups, with a total of 6 themes being identified after thematic analysis, and wherein each theme and sorry, wherein each sort of interview or focus groups was sort of broken down into particular discussions and sub themes. Six sort of themes identified were and included, number one, training methods or methodologies. Number two, in-store responsibility. Number three, locum and multi-branch pharmacists. Number four, customer support. Number five, customer success. And six, ongoing feedback. Excuse me. The results in the works or at least the preliminary results had highlighted the current standard of training and support offered by patient medication records, or PMR system providers, had been sort of inadequate, So PMR systems consist of many distinctive features uh, in features integrated into one system, enabling many services. And as such, the training provided would dictate how effectively the software system is onboarded, and determine whether whether the most is made out of sort of the features of particular PMRs. System mechanisms and commonly are commonly only used when problems sort of arise, but expectations from some of the participants who were involved showed that customers sort of expected more and more in line to sort of optimizing patient care. So just acknowledgement to Lewis A. from Cardiff University at the time where this work was being conducted in around between 2017 2018, and wherein again there was a collaborative effort between industry and between academia, and from my part, it was great to be involved as one of the sort of co-supervisors in this works. Thank you for listening to this overview in this Storm Robotics production around the extracts equilibrium, and hopefully there'll be another one to follow. Thank you.